Hello.
My cat's been acting strange lately, and I don't know what's wrong with them.
Okay. So, has he or she been vomiting?
Occasionally, yeah.
Occasionally? What about not drinking or eating?
I've noticed that she doesn't eat as much as she used to, but she's still eating a little.
Okay. And she drinking excessively?
Sometimes, often, yeah.
Okay. And she frequently urinating?
Yes, definitely.
Oh, okay. So, based off what you told me, it sounds to me like your cat might have feline kidney failure. So basically, you can look through here, but at first, so basically there's two types. So there's acute kidney failure, which happens suddenly, and it can be caused from poisons like antifreeze or like toxic plants like lilies. It can happen from shock, usually from dehydration or rapid blood loss. So, and then the other type is chronic kidney failure, which happens from over months or years, and it's usually from like a congenital disease that they have. So like their parents had it and they passed it down to them. Has your cat gotten into any chemicals like cleaning supplies or anything like that?
I'm not sure. I haven't really been watching them lately.
Okay, so yeah, and then just look through. There's causes. So like I already explained some of the causes that can happen. Treatment, usually it depends. If it's an acute, we normally would do some blood work to find out how that happened. So that's probably what we're going to do today for diagnosis. We're going to take a sample of your cat's blood to make sure it doesn't have any waste in it, because usually if we find waste in the blood, it means that they have a kidney problem, because their kidneys are supposed to filter out their the waste of the blood, and if it's not doing that, that's an issue. So diagnosis, we would do blood work. We would take a urine sample and we'll look under in a microscope, make sure there's nothing abnormal, and if there is, that's when we would go to the treatment option. So usually treatment is kind of a sad thing because most treatment is expensive. So your options for treatment can be surgical and medications for acute. And if we find it acute, we can give you some fluid therapy like IVs. So we can insert IVs into your cat and filter out your blood like that, or their kidneys like that. And if we find out from the test that it's chronic, then we will have to resort to either dialysis, which is where we would take a machine that filters their kidneys out, or we can do a transplant. And dialysis and transplants are very expensive. They can range from anywhere to $2,000 to $3,000, and a transplant's more like above $10,000. For the chronic, if we find out it's chronic, the most owners will choose to do euthanasia because it's the least cost effective. If we end up finding from the blood work that your cat doesn't have kidney failure, it just has some obstruction that's blocking the urine from coming out or something like that, we can prevent it still. So we would offer you a veterinary specific diet, and we'll recommend you to keep your pet hydrated more and follow up. So after you decide what treatment you want to do, if we find out that it's acute, we will have you come back weekly and check up, make sure the kidneys are functioning the way they're supposed to. And if they are, eventually your cat will return back to health, and that's where it brings us to the life expectancy. After treatment, your cat is expected to live anywhere from 4 to 6 years, depending on how their lifestyle is. If it changes based off of the treatment you took, then they'll live 4 years usually, and it's 4 years comfortably. So that's it.
Okay. Will the disease be able to come back?
It won't be able to come back if you don't do if you keep the treatment up and like you follow with the treatment. If you stop treatment and you don't change their diet, or if you don't change how they're like eating or drinking, it can come back. Or if they get treatment but they end up licking up chemicals again or getting into poisonous stuff, they can possibly get it again.
Okay. And what are some of the preventions for it?
Prevention, you can give your cat a more protein-based diet. It's recommended by your veterinarian. So
okay.
your veterinarian will tell you what type of diets to give your cat. Also, just keeping your cat away from anything that's like hazardous chemicals, so like cleaning supplies or antifreeze, so like keep your cat out of the garage or out of your cleaning cabinet, and don't have any like toxic plants in your house.
Okay. Okay, thank you.
Yep.